my name is Priit Tohver. I am the Director for Global Affairs and Digital Health here at the Estonian Ministry of Social Affairs. The online e-health record is something that every Estonian has from birth, and which all doctors are mandated to transmit information to. So it contains really everything about your health, your recent appointments, your prescriptions, your time-critical data, things like your allergy, for example. Are you pregnant or not? This is the kind of information that a doctor needs, especially in an emergency situation. If they've never seen you before, all they need to do is just write in your ID code and they can find out all this information that they need to treat you at that very moment. So the impression that we are certainly getting is that yes, Estonians are quite comfortable with sharing their digital data, but of course this isn't a blind trust. This is built on the security of our system. So our system really runs on 6 pillars of security. The first pillar is, of course, secure authentication. So you need an ID card or a mobile phone with a mobile ID software to identify yourself, to even be able to access the system. Then the second pillar is that everything that gets transmitted, all medical documents, are digitally stamped, which means you know who they're coming from and you know that this data has not been altered. Step 3 is that everything you do in the e-health system leaves a trace. So everything is set up using hash chaining technology, which means that every move in the e-health system has a trace which cannot be changed. Then step 4 is that all the data, all the medical data is separated from personal data. So even if you manage to find the medical data somewhere, you cannot really connect that to who that data belongs to. Step 5 is that data is also encrypted from technical administrators, so there's no way they can see the data unless they get a special permit from the government. And then step 6, which brings it all together, is monitoring. So everything, as I mentioned, gets logged, but then someone also has to monitor these logs and take respective action if something has been misused, for example. And we are adding a 7th pillar. We're going to transition to a blockchain, to a KSI blockchain-based system. So that's going to add security, but the system is already immensely secure. So in 10 years' time, we've had no major data breaches, and really the system is already GDPR compliant. So we certainly see a lot of advantages for e-health solutions, for doctors, patients, for the government, for entrepreneurs. So for doctors, number 1, it's a way to save time. It also drives better quality for doctors. So when you look at something like the e-prescription decision support software that we use, when I, as a doctor, start prescribing something, the decision support software automatically warns me if something I'm prescribing is counterindicated based on other medication that the patient is taking. For patients, as we mentioned, it's empowering. You know, you have full control of who can see and use your data, and you can also use something like the patient portal to access a number of services. So something very simple, like getting a health certificate, is something that you used to do in a doctor's office, whereas now you can mostly do that in a patient portal, which saves you and the doctor a lot of time. And it's also a boon for governments. You know, we get better data, which we can use in policy making, which is hugely important, and eventually it is also a way to save money for the system, which we need to do. And for entrepreneurs, these massive amounts of health data that we are gathering is really a vital resource to drive innovation and research. And Estonia is doing what it can to help these entrepreneurs and help researchers make more innovation happen in healthcare. So what we're doing, we are building a data lake, which is a way for researchers and entrepreneurs to access massive amounts of pseudonymized health data to use for research and innovation purposes.